Well, welcome to today's update. It is Wednesday, the 22nd of April. Now, quite a few things to bring you this morning. I think I'll just start with a couple of graphs I think these are from World Meter, and shows the rapidly changing situation with this pandemic. And unfortunately, the change is in the upward direction. So these are the global figures. These are the official confirmed cases. And we can see there's this very steep rise in cases. So it didn't take long to get from 1 million cases here to 2 million cases here. And this line is still going up. Now, I know this trend has been bucked in various places, but this is the global position from this world data site, which I'll paste the link for, of course. Lots of useful, interesting things on here. And the deaths, as we would expect, are a bit behind, but the shape of the line is very similar, unfortunately. So we've got an increasing number of deaths and an increasing number of officially diagnosed cases. And it's hard to see globally that this is going to change. In fact, I think we can say this with some degree of certainty now, unfortunately, that globally this pandemic is going to greatly increase. And a lot of people are going to die. The proportion of people are going to die. And in some places, the case fatality rate is going to be higher. And we'll look at some reasons for that shortly. First of all, I just want to say something about masks, which I've been thinking about. Now, I'm going to put the link again, but we did this article a few weeks ago called Turbulent Gas Clouds from JAMA, the Journal of the American Medical Association. And what this was showing was we breathe out these droplets. And as we know, the virus is exhaled in the droplets of an infected person. We know that. It's in the stools as well, usually, or often, but it's primarily in these droplets. And these droplets can be breathed in by other people, go into their mucous membranes, or go onto a surface and can be touched by other people, and their hands can go to their mucous membranes, which is why hand washing is so vital. You know that. But just with ordinary speech now, my droplets are going 2 meters away from me. If I cough, it's 5 meters, and if I sneeze, it's 7 meters. So 2 meters is 6 feet. 5 meters is about 17 feet or 16 feet or something. 7 meters is well over 20 feet. So we're talking about quite long distances here. And the reason it goes so far is just the physical momentum of it. So there's been a lot of umming and ahhing about wearing masks, and people haven't been quite sure. But I'm actually fairly sure now that we need to wear masks, and everyone needs to wear them in public places. Now, outside with good distancing, I believe it's okay. But inside, I think everyone should be wearing them in public areas. And I'm thinking particularly about supermarkets and public transport. Now, what really convinced me of this was I was looking at the data from Austria. And Austria introduced wearing masks on the 6th of April. In supermarkets, it became compulsory, and I think in public transport as well. And their new cases are now down 90%, so it's quite amazing. So the total number of cases in my country is 130,000 odd, and in Austria it's about 14,000, nearly just under 15,000. So it's a big difference. So what we're saying is, if we wear these proper tight-fitting N95 masks in hospitals, clinically, to protect ourselves, then they will filter out a lot of the particulate virus particles in the water droplets. But the loose-fitting masks and the homemade masks aren't going to protect very much. They're not going to protect me very much. But what they will do is, if I'm infected, it's going to break the momentum of my air going forward and stop me infecting other people. So masks are going to, or public wearing masks in supermarkets and public transport is going to stop infected people infecting others, I believe, or substantially reduce that, because it just stops this momentum. So instead of the droplets and the viruses going meters or feet away from me, they just stay near me and dribble down me. Then I can go home and wash my clothes. So anything that breaks up the momentum of the air current, and we've looked at lots of beautiful homemade masks on this channel before. So anything. And so I was just having a look this morning. I just found my motorcycle scarf here. So I just there you go. I've got a mask. I mean, it's not going to protect me, but if I'm infected, it's going to. So when I'm breathing on my hand now, I can't feel the momentum of my air. It stopped the momentum of the air. Whereas if you put your hand in front of your mouth now and talk, you can feel the air going onto your hand. Just the momentum of the air. So I'm convinced now we should be wearing masks in public areas because we don't know if we're infected because of the asymptomatic carriers and the pre-symptomatic carriers. So quite keen that my government introduced that now for public transport and supermarkets. And so I mean, China, Austria, Taiwan, Czech Republic, Slovakia, South Korea, Japan have all used these, and with apparent success, because we don't know who is infected. But it needs to be for everyone, so it needs to be a mandated, socially required thing. Now, talking about going back to the global situation, we've just looked at these graphs here of the increasing situation throughout the world. Now, what I was watching this morning, an interview from the United Nations that was really, what word would you use? Distressing, really. The United Nations are warning of the risk of famine affecting 250 million people. This is just potentially huge. And they used a lot of language I didn't like at all. So they were talking about biblical proportions and the problems exacerbated by war and locusts. Literally plagues of locusts flying over Kenya and areas of East Africa. Just like the biblical stories, plagues of locust. And we know there's been a lot of war. So there was already challenges from war and locusts in many parts of the world. And this COVID-19, of course, is making it worse. So really quite distressing that 500 million people could be hungry quite soon. So they mentioned West Africa, South Sudan, Yemen, Syria. And again, we know why these countries are challenged. We don't need to go through it. 10 to 36 countries could be infected. And they also used a word I didn't like at all, destabilisation. So this really is a global emergency. I mean, that the COVID-19 is a global emergency, but it's brought to light other global emergencies, and the COVID-19 problem is synergistically interacting with these other problems to make the problem 10 times bigger. It's not 2 + 2 = 4. It's 2 times, well, 3 times, whatever it is. It's synergistic. It's not 2 + 2 = 4. It's 2 + 4 = 10 sort of thing. So the war, the locusts, the ingrained poverty, and now the COVID-19 as well, as we looked at in the Malawi situation recently. So really is a time for the world to start coming together on this, because we can do this. We have the resources to do this if they are correctly distributed. So globally, as we've seen on the graphs there, 2.5 million confirmed cases. We know it's way higher, 17,000 confirmed deaths. So we looked at Africa already a couple of days ago with a particular interest in Malawi. So now in the African continent, in a sense, it's fortunate because the pandemic reached there relatively late, but is there now. So the testing throughout Africa is abysmal, of course, and yet still 24,000 confirmed cases. So it's got to be way higher than that. And we did look a few days ago that we believe there's community transmission in Malawi, for example, already. Treatment for all is not going to happen. It doesn't happen as it is. So many people who get sick with COVID-19 are going to die without access to anything like adequate treatment, or indeed access to treatment at all. So apparently, according to the IRC, just a report I heard on the German news, South Sudan, 12 million people, 4 ventilators. Not that we're saying ventilators are the panacea, but it just gives you an example of the healthcare provision challenges in many areas. And the other thing that I've been thinking about that really concerns me, so in many African countries, so for example, I believe Kenya's about 17% of the adult population has HIV. South Africa, I think it's higher, around about 25% has HIV. And that stands for human immunodeficiency virus. It reduces the efficiency of the immune system. Not good. Tuberculosis is absolutely endemic in many African countries and Asian countries. It's there all the time. So the person is already weakened and the immune system already challenged through tuberculosis. So what is going to be the death rate in people that have HIV who become infected with COVID-19? What's going to be the death rate of people who already have tuberculosis, many of whom are not adequately treated, who then get COVID-19? We don't know these questions. But I strongly suspect the death rate is going to be much higher than if someone was healthy when they caught the disease. Ebola, there's even cases of Ebola now in Africa, which is another terrifying viral disease. Malnutrition. Now, malnutrition is common, especially in children, and this greatly reduces the efficiency of the immune system. So thankfully, the deaths in many developed countries and China amongst children have been very low. Is this going to be the same in Africa? The prospect is just terrifying. We could find out we have a 1%, 2% case fatality rate in children in Africa because of the malnutrition. I don't know. I don't want to make numbers up, but what I can certainly say is that if a child is malnourished, they're less well equipped to mount an immune response to the virus. And untreated pathologies. Diabetes is rampant all around the world, especially in Asia. And diabetes, we know, increases the risk. Hypertension is rampant. But basically, there's pandemics of diabetes, mellitus, and hypertension. These are all over, very often not treated, not recognised, because very often they have very limited symptoms until complications develop. So these are going to increase the probability of serious illness and death in cases of COVID-19, and we've got to have huge amounts of all these things. So very, very concerning for these countries with challenged healthcare systems or hardly any healthcare systems, as we looked at in the Malawi example, or very poor healthcare systems. Certainly most people not having access to healthcare, anything like we do in the West. Now, South Africa, increasing cases, but not massively increasing, and there is some testing in South Africa, 58 deaths. Now, but there's many protests and quite a bit of unrest in South Africa because so many people need to earn their day's food by that day's work. But the government seems to be being very strict, and this is interesting, frightening, I don't know what word you want to use. 73,000 military have been deployed to enforce the lockdown and help medical services in South Africa. So you have a situation there where there's 73,000 armed, presumably armed, soldiers walking around the streets of their own country. It's not a nice picture. It's not a nice picture. But we know that the lockdowns will reduce the transmission. So now, people loitering have been arrested. Now, this is what you call the informal sector. Many people just sell things on the street, and they're not allowed to do that. So, but then again, if they don't sell things on the street, they can't feed the families that day. And there's many migrants in South Africa as well. So that's another huge problem. That many migrants are kind of falling between the cracks in society. And in fact, there's problems with migrants all over the world. We really have to think about these groups that are going to be particularly challenged. Now, the US. Just before I look at the US, I want to show you those numbers in the US. But first of all, I want to show you a picture here. And this is from the World in Data, which I'll put a link on. So COVID-19 deaths, the increase in deaths. So we see that these countries, Italy, Spain, France, had the infection early, but my country is catching up. But we can see that the overall, because of the lockdowns, the rate of increase here is not as dramatic, because the steeper the line, the greater the rate of increase. But look at the United States. Let's just trace the United States line. See that? It took over the United Kingdom rates of death there. And you can see the curve is so much steeper, meaning that more people are dying more quickly. And it's still going way higher. Now, I know this is slightly misleading because there's a lot of people in the United States. And this is the total numbers here, but it's still an alarmingly steep line. Not so much the overall numbers, because per capita they're going to be slightly less, but it's the steepness of the line that's concerning. The line is going up very steeply, very rapid increase in rate. So the United States is, well, it's getting on for 1 million, isn't it? It's 825,000 cases, over 45,000 deaths now in the United States. As far as I know, the Canadian and the Mexican borders are pretty well shut in the United States to reduce movement of people. Now, a couple of weeks ago, we talked about this election in Wisconsin, and at the time I said this is going to cause cases. There's no question about it. That they carried on with this election in Wisconsin. And it has. 6 voters and 1 poll worker from Wisconsin have tested positive. But that's just what's known about. So obviously there's more cases, and holding that election is going to mean that there are going to be more cases and ultimately more deaths, as we predicted. Now, the federal advice from the White House in the UK is 2-week downward trend before states start reducing restrictions. So states like North Carolina are keeping restrictions, but Georgia is leading the reopening schedules. So we see a very disparate situation in the United States. So places like North Carolina keeping shutdowns, places like Georgia starting to open, places like Tennessee starting to open from Monday. Now, we've seen the increase in cases in the United States. There's no question about that. Now, there is hopeful data from the United States, and let's just look at one other graph here. So this is new confirmed deaths. So this is the new deaths, and a 3-day average means they don't take one day; they take the day before that day and the day after, and then put it on the graph after. So it's kind of a roll. They call it a rolling average. So the number of deaths in the United States went up hugely. So this is the number of deaths per 3 days. And then it went down. So it is going down. So the number of deaths is going down. Yet the number of cases, as we saw here, is still rising. So unfortunately, the risk of more deaths in the United States is there because the cases are still rising. So from a medical point of view, reopening the things in the States are going to cause more deaths. Just while we're on this graphic, the United Kingdom deaths are levelling off, which is good to see. Italy and Spain, the level of deaths is definitely trending down there, isn't it? These are the new cases. Now, all of these are still terrible numbers of deaths. So like, for example, there on the 21st of April in Spain and Italy, they were both on about 500 deaths a day. So that's still 500 new deaths. So the overall number of deaths, of course, is still climbing, but the trend is going down due to their strict lockdown measures. And it is the United States as well, but it remains the fact that it's, medically speaking, it is far too early to start reopening things in the United States because of the number of cases and the lack of testing. But I understand the argument from economics. People need to make a living, as we've seen. So I'm not saying what's right and what's wrong. I'm just saying that these reopenings are going to cause more cases and going to cause more deaths. There's no question about that, because the reopenings are going to mean more social interactions. Now, the UK. Great increase in number of cases, another 823 deaths. So we know this number's levelling out, but it's still, this overall number, of course, is carrying on increasing. So 823 deaths yesterday in my country. So it's not falling as dramatically as we'd like, but it is. The trend, the overall trend is levelling out. Now, the RAF has just brought in a load of PPE from Turkey. It's coming a few days late. But the epidemic in Turkey is growing greatly as well. And I was talking to a contact from Malawi, actually, and they said part of the problem is that the richer countries are buying up all the PPE and poorer countries can't afford it. So quite a lot of controversy about PPE at the moment. And of course, we go through so much of it in hospitals, just go through it all the time. It's a constant river of supply that's needed. Now, care home staff testing difficulties have come to light. Problem in care homes we know about. I mean, I could comment now. I mean, the number of deaths here in the UK is in hospitals. So if we add the care home deaths and the deaths at home, we can probably add 50% to that. We're not really sure. Certainly add more to it. The latest data we have was the week, what we looked at yesterday up to the week ending the 10th of April. And then there's this lag in the data. But we can add at least 30% to that and probably add 50% to that, unfortunately. So care homes need testing so they can look after their vulnerable residents. Because if people can't get tested, if the staff can't get tested, that means they might have to go home and self-quarantine. That means they can't work. So there could be care deficits. Or arguably worse still, they could be still working and therefore spreading the infection. So again, as if we needed it, the need for testing is highlighted repeatedly. They are talking about mobile testing units to visit care facilities. Now, the peak of hospital deaths in my country have been calculated to be about the 8th of April, which probably does look... Let's just look at that graphic again. So 8th of April would be, that's be about there. I would say the peaks... I would say the peak was probably nearer the 12th of April. Something like that. Anyway, it looks like we're hopefully past the peak now. That's probably the main point. Now, this is incredibly encouraging. Oxford University and associated biotech companies have a vaccine. And they're starting human trials. It's Wednesday today. I think they're starting them on Thursday. So these will be human trials in young healthy volunteers. Now, the question is, on that phase 1 clinical trial, will it be safe? And then if it's safe, and then the vaccine will be tried on a wider range of people and older people as well, and see if it's still safe. And then we'll have to see if they're raising antibodies. So it's not saying that the vaccine's out tomorrow, but for human trials to be starting tomorrow is good. That's encouraging. The government's given a lot of money, and if it works, the Oxford group think if it works, this vaccine could be available by the autumn. Now, if it is, that will just be miraculous. And that depends on it being safe. It depends on it being efficacious. It's got to be safe and it's got to work. They're the two criteria, really. But the manufacturing capacity to take the vaccine from the lab into the factory for mass production, the manufacturing capacity is being made now. So as soon as the scientists get it ready, it will go to the manufacturers and we can start bashing out the millions of doses that are going to be needed, and indeed billions of doses that are going to be needed. And other countries are quite well on with their vaccine. This vaccine is being developed faster than anything else has in the history of vaccination. So it's encouraging. It's encouraging, but it's not yet guaranteed. If you're putting money on it, you might say, well, maybe we won't have a vaccine actually until 2021, but it's hopeful. Work is progressing. Now, Mexico and poor countries in South America, Mesoamerica, South America, are a concern. Increasing cases and deaths. Now, Mexico's gone on to what they call phase 3 of the pandemic, where there's a rapid ascent. So in other words, they are now expecting the number of cases. So that's the number of cases. That's time. They're expecting it to rise quite steeply now, and they're predicting that will carry on rising over the next weeks, unfortunately. And they think that the peak spread will be in early May. So perhaps in about 3 or even 4 weeks' time in Mexico. Lots of prisoners have been released because jails are a hotspot, especially in poorer areas. Prisons all around the world are a concern, especially in poorer areas where prisoners often live in very overcrowded conditions. The spread is guaranteed. But good to see that lower risk prisoners are being released in Mexico. Many migrants in transit in Mexico. So there's many people coming from South America hoping to get to the United States, and they're stuck in Mexico. Away from home, very limited support networks. Again, this is a vulnerable group that are very, very concerning. A lot of people are at great risk in these situations. Now, Spain, as we looked at, the death rate is declining. But they've all had an awful lot of confirmed cases now, but way more than that in actuality. Deaths, another 500 just yesterday, 21,000 deaths in Spain. So this number is going down. It's no longer in the 900s or so. It's going down. But of course, it means that this number is constantly ticking up, and to tick up by 500 a day is quite a large margin, even now, even despite the measures taken in Spain. So the Prime Minister's saying probably a lockdown for another 2 weeks into May, although there is some limited return to work in Spain. So where does that put us? The disease is contained in some European countries at enormous cost. These are costs that many Asian and African countries simply can't afford, so they can't take these lockdown measures. Or if they do, there's the real risk as identified by the United Nations of starvation. So this really is a time where we have to make sure that everyone's basic needs are met, because people shouldn't be dying. Children shouldn't be dying just because they don't have enough to eat. We really need to address this as a world. Quite how we do that, I don't know. But if we don't, people are going to die. So really, it's there's a lot to be concerned about at the moment, and there's going to be spread and more cases in the next months, and more deaths globally for sure. I think we need to wear masks in public. I think that's a simple measure that we could be taking. We need massive more testing. So from the lockdown that we're in Western countries now, we need huge amounts of testing, and we need, I believe, mask wearing in public to stop infected people infecting others. Let's see if anyone's listening. We'll obviously keep updated on this. Now, I did put a couple more graphs on there. We looked at that one. Now, this is from the World in Data. I'll put the link. I really would recommend this site. You can spend hours on it. That's the risk. But tests per 1,000 people. So we look at the tests per 1,000 people, and look how well Italy's doing. This is not number of tests. This is tests per 1,000 people. United States coming up now. South Korea, even though it's not at the top, it must be using them very judiciously, because their numbers have gone down, which is good. But then we go down Turkey. Look, this is South Africa testing here. So look at that. So that's the South Africa testing compared to the Italian testing. Senegal, Indonesia, other countries we could mention, basically hardly testing at all. And yet testing is the only way we know what's going on. What's this one? Daily deaths. So this is the rate of death. Now this is a logarithmic scale. Always check when you're looking at graphs if it's a linear scale or logarithmic scale. So that's 10, 100, 1,000. So you can look up your own country there on that excellent website. Again, another Oxford University spin-off group, I think. Anyway, it's very good data there. Australia. I wanted to mention Australia. How could I forget such a wonderful country? Now, in Australia, this is the total number of confirmed COVID-19 cases. So, of course, it's going up, but we see it's flattening out. But this is the number of new cases here. So we see that the number of new cases has been going down for some time now. The number of new cases in Australia is remarkably low. So this is their shape of new cases here, and it's going down beautifully. So excellent progress there in Australia, doing very well. And of course, as these numbers continue to go down, that will flatten out and then eventually start falling. So encouraging news, very encouraging news from Australia. I'm quite delighted about that. Now, Australia published this, which is really good. They have this graphic, and they publish it every day. And again, I'll publish the link for you for this. So it's official Australian government site. So it's updated every day. So as we see, this one is the 22nd, because Australia are a bit ahead in time, aren't they? Anyway. Total cases, total deaths, recovered cases. And then they give the breakdown by state. So New South Wales, Northern Territories, Queensland, South Australia, Tasmania, Victoria, Western Australia. I can't quite remember. Someone will tell me. Now, these are the number of patients in hospital, current cases admitted to hospital. So again, you've got live data on that, which is good. This is the testing. So they've carried out nearly 500,000 tests in Australia, which is a lot per capita. Then it gives you the daily number of reported cases, the graph we've just looked at, really. This is interesting. It's very, very interesting. Well, let's look at the one at the bottom first. Age, deaths by age. So thankfully, fewer deaths in the younger age group, increasing deaths with increasing age, less in the older age group because there's less people left to die. But this is interesting. In most countries in the world, we see a great preponderance of more men dying than women, but in Australia, so that's blue male, that's female. So in the younger age group, we actually see more younger women dying than men. So male, female, male, female, male, female. Interesting. Now, why that is, I have no idea. Because in most other countries, we're seeing a lot more men dying than women. So very interesting studies there that could show some fascinating things about this disease. Now, Australia also show the breakdown by their maps. Case of infection. And most cases, it's a bit blurred, but that says acquired overseas. So still most cases in Australia were acquired overseas, and quite a lot were acquired from ships. So the cruise ships. So very interesting in Australia. So interesting that the deaths by age is as you would expect, but the deaths by sex are not. So great to see that less Australian men are dying, but why that is interesting. I don't know the answer to that. I don't think anyone does. So excellent live updates there from Australia. And just to finish today, I've just been spending some time with Angie in the United States. Always good to spend time. Seriously, it is humbling the way that people around the world have invited me into their homes. I do appreciate it. Thank you, Angie. Thank you for watching. Thank you for sending the picture.